Like the rest of you, we're trying to make sense of this crazy thing that we call life. I'm RJ,
I'm Jasmine.
And I'm Khalil.
And I'm unique.
and welcome to Try Not to Overthink It. Every day we find ourselves discussing many different topics, ranging from trending news to the state of our society as a whole. You name it, we've probably talked about it. After many heated debates, we decided to expand and share our conversations with you and give them to you from both a therapist and a social worker's point of view and get your input. If this is your first time here, we'd like to thank you for checking us out, and we hope that you'll stay and become part of the tribe and participate in the conversations. So today we have a guest with us, Dr. Yedla. So I have had the pleasure of working with Dr. Yedla for the past 3 years,
Yes.
and she is a psychiatrist. So in the past couple of episodes, we've talked about the importance of mental health and why it matters. And so I thought it was very imperative that we bring on a psychiatrist who prescribes medication, because that's something that I always have to explain to people whenever I talk to them about mental health or just the treatment of mental health. I have to explain the difference between a psychologist and a psychiatrist. And because people think that they're either the same or they have them mixed matched in what it is they actually do. So I thought it was very important to bring on a doctor, because she is a medical doctor. She went to medical school, and actually get her input on why mental health is important. Because it's one thing to hear it from therapists or from social workers why mental health is important. It's another thing to hear it from somebody who has far more experience in regards to treatment of mental health. So, Dr. Yedla, would you like to share a few words about yourself?
Uh, there's not a whole lot. Thank you, RJ, and the team for this opportunity. As RJ mentioned, I'm a psychiatrist with training medical school in India and then followed by specialty training here. And I've been working since 2003. So I've been doing this for a bit. I'm happy to share my thoughts and experiences, and hopefully this will help maybe at least a few. Thank you again.
So, we're definitely glad to have you, Dr. Yedla, because again, with the numbers rising, it appears like every single day we see different things that, pop up on the news in regards to, someone becoming unwell, someone taking their life, rather that be somebody famous or somebody that's just an average everyday person. And we started on this conversation in regards to why mental health matters, because our goal as providers is not just to just talk to you or talk with you. Our goal, our jobs in and of a nutshell is to educate you as well. I find that when people know better, they do better. And because there's a wide variety of different services that are available to people, I felt that it was very important to kind of, start the conversation.
Yeah, I definitely agree. The more someone knows they have access to, then they're able to choose what works best for them or even to try things. Sometimes they may say, all right, I'll at least try this to see what I have. But if you don't know, you can't. I'll say like I always tell people, I can't know what I don't know. So I can't do anything about what I don't know. I can only do something about the things that I know and I have access to. So I think the more we provide education to those that we serve and to our communities, people have access.
Access to care is one of the things that I believe, especially from my experience working in the mental health field and working in, uh, the lower socioeconomic, um, you know, clientele. It was very difficult for them to accept that they had a mental health diagnosis. And it was very difficult for them to have their families understand how important it is to take medication, how important it is to make sure you have insurance. As a case manager for Wellstone, I did a year of outpatient work, and I got to actually work with some of Dr. Yedla's clients, and some of them were very educated. RJ and others like Chasman, they did a wonderful job of educating some of the clients on why it's important to take the medication. And I know Dr. Yedla, you educated many of them as well That was what I ran into. That's the problem sometimes in certain communities, that they don't have a trust because they don't have the education. And it's hard to trust if someone tells me just to take something, and I don't get the proper type of education, and they're trying to rush me into, hey, take this, and this is going to do this for you, and then push me out the door. A lot of times, I think just fear alone, people won't take the medication, or they won't take the suggestions. And then you have the people who don't have the insurance, right? So then the monetary becomes a problem, because you have to make that decision. Am I going to pay for this medication that people are telling me I need? And their families have to be on board with it, right? Because if you're going to have to spend $50 or $100 a month, you got to get everybody on board with spending that money. The financial implications, right, on lower economic, families. So I definitely think it's an important thing to educate.
Right, and it goes with education goes along with discriminating what is good for you. Like I have worked in crisis, and just because one thing may work for one person, the beautiful thing about, or the great thing about mental health is it's individualized. I don't give, like Dr. Yella doesn't prescribe the same medication to each client, and treatment plans are also individualized as well. So you're coming in and as an advantage. I'm not treating you like a one size fit all. I'm treating you as an individual person. And I believe that just goes longer, or it goes a distance when it comes time to actually treating the clients for their individual diagnosis. Most people don't know that everyone doesn't have the same diagnosis when they come sit down. Everyone is diagnosed on an individual basis through screening and resources. And like Dr. Yella knows that most of the time with her clients, it's probably a lot of psych workups and things like that where they go through, and it's just not me sitting down looking at you saying, hey, you're bipolar. It's a plethora of different things that you have to go through just to get a diagnosis, and not just one.
Dr. Yedla, I have a question for you. So from your experience, what do you feel causes mental illness, or what are some contributing factors to someone developing issues with mental health?
Well, the short answer is that we don't know exactly what causes mental illness of any kind, but there is some evidence that a lot of different diagnoses may run in families, so there is a genetic tendency towards it. But certainly things like life stressors or events, drugs of abuse, these themselves may be some contributing factors to either causing or precipitating. And even if they don't overtly cause it, they may certainly be the last thing that happened before the onset of mental illness. So this is where studies are being done and being looked at, but we are not able to pinpoint and say exactly this is what is causing depression or this is what is causing schizophrenia.
Okay.
I think that was awesome that she said that it could be like the life factors, because we sometimes discount that. Like a person's like, well, I was fine 10 years ago, but yeah, your life has dramatically changed. And so those factors could contribute to you developing a mental health disorder. I think someone always, we get clients that say, I'm not crazy. No, you're not crazy, but life has shaped you in such a way that this is the way your brain and body is responding, and your behaviors are responding to the things that have impacted you in life.
Right. In addition to what Unique was saying, trauma as well. I know, like, we are so resilient to a lot of things that happen, like environmental, living in stress, living in poverty, living under stressful situations, going to college and things like that. So I know a lot of times, like, we discount the factor of trauma in our past, but we do have to look at that too as a factor.
Mm-hmm. Mm-hmm.
And also, thank you for mentioning, Dr. Yella, just talking about the genetic factors. Myself and RJ, we've actually gotten to see some of that by visiting certain clients and their families.
For sure.
You see the family dynamics and you're like, well, the mom seems to have something going on with her. It might not have been diagnosed, but then you'll see the son. And, and once you start meeting other members of the family, sometimes, it's blatant. It's right in your face, and then there's
Yep.
sometimes it's a little covert, but you
Mhm.
start seeing things, and you start seeing some of the issues is that they're not going for help.
Yeah.
They're
Yeah.
not getting the treatment, and some of them just don't have the access to care because of monetary reasons, like we spoke before. But you do see it genetically, and the mind is so fragile. Chasmin, you talked about trauma. I've actually experienced this. I had two friends be in a car wreck seriously when we were teenagers, and one of them would not drive. He
Mhm.
didn't get his license. This happened when I was probably 17 or 18. He didn't get his license until he was almost 40. And it was just, he refused to drive,
Mhm.
refused. And I try to tell people the mind is fragile. You could go through something, it can really affect you.
Mhm.
For sure. I mean, we as human beings, we're very complex. We're not, simple as much as some of us try to be. Like for me, I try to be very simple, but I'm not at all. You're like an onion. You have so many different layers and so many different pieces that go to you, that when something is out of whack, it just kind of compiles and piles up on the previous level. And so for a lot of us, when it comes to checking in and just making sure that our mental is okay, our mental can start to affect the other pieces or the other facets of us. And a lot of people will focus on their physical, but then don't focus on their mental. We spend so much time focused on our outward, appearance and the way that we look and the way that, the package itself is presented, that we don't take as much time as focusing on our inside. Like you'll see people go to the gym, they'll put 15, 16 hours per week into the gym. But then are you putting that same amount of time into developing yourself mentally,
Mhm.
making sure that your emotions are in alignment, making sure that your thoughts are in alignment, making sure that you're not in a bad place.
Yep.
And a lot of people just don't do that. They don't do that. And it's not that they can't do that, but for some people, it's what they've always seen. Like like in school, they teach you about nature versus nurture, where your environment plays a big part into who you are as a person. And then also how you're raised plays a big part into how you are as a person. I can tell you firsthand, some of our clients, it starts at home.
Mhm.
It starts at home because when you're having to not only battle the client that's sitting in front of you in regards to participating in treatment consistently, because the treatment is only going to be as good as you consistently
Mhm.
participate in it.
Mhm.
If you're only going to do it sometimey or wishy-washy or haphazardly, you're going to get those same type of results. But when I'm having to then go to the parents and because they live with family and be like, please help me. Like, I need you to watch them take their medicine. I need you to make sure they get to these appointments. The family's like, well, they don't want to do it. And I don't want to upset them. Or, you have some sort of religious factor that plays into it, or you have some sort of cultural factor that plays into it. I'm just like, okay, I can only do so much as a provider, as someone that doesn't live with them. Now, again, I try my best, but it gets to a point where I'm only one person and there's only so much that one person can do when, again, I don't live with this person. I don't experience this person 20, the other 23 hours of the day. I might see them for 1 hour per week. And in that week, after seeing me, they may have come completely off the rails. And now it's become something that it could have potentially been prevented had the family worked with us and had there been a complete cooperation and collaboration of effort.
Mhm. Mhm. I think too, people, we talk about their behaviors, but people are taught how to respond to certain things that happen in their life. And so when you have a client who you're trying to get on medication management, it becomes difficult when their trained response is to do something counter to what you're teaching them in
Right.
therapy,
Mm-hmm.
or that's countercultural. And so because they say, I've had a client, I think it was this past week, she's like, her dad told her, you don't need medication, you just need to pray.
Right.
You don't need all of that stuff. And so, but the client verbalized feeling better after taking mood stabilizers. And I said, well, how do you feel about that? Given that you are taking this medication and you are responsible for your behaviors, thoughts, and feelings, how does that change based off of what your dad says. She's like, well, I'm going to take it because he's not a part of my life. But so many times we have it the opposite way as clinicians, and I'm sure Dr. Yedla has seen. It's not always that simple that I'm just going to do it, because they have so many other voices that are guiding their thoughts and behaviors. They usually go with whatever their community agrees to.
Mm-hmm.
So I think part of the thing I'm hearing is it doesn't have to be either or. So what we try to tell our patients is, yes, by all means, pray. By all means, do yoga. Do it 4 times a day if you could, But take your medications too. I mean, it doesn't have to be either or. And sometimes I think we do a decent job in conveying that, and sometimes it's a struggle. The struggle is real on some days.
Right.
So-
Well, I like the fact that Dr. Yedler's mentioned that a lot of people suffer with all or nothing thinking, right? It's got to be black or white. It's got to be either or. That's difficult in our society because a lot of people don't have that gray area. With medication, sometimes we as clinicians don't give them the right to have a little bit of a gray area. I'm like, you better take it, or if you don't, this is going to happen. And then we're locking people up and all that other stuff. So, I think what you said is very on point. And if we could convey that message, I hope other clinicians are listening, that we can tell people, hey, it's okay to have some spiritual foundation, but it's also okay to take your medication if maybe we can combine the two, meet halfway, and be able to incorporate all those in your life transition.
Right, and I like that Dr. Yedla's a female, because I think that the verbiage and hearing it from a female is different than hearing it from an authoritarian male perspective as a psychiatrist, because most of the clients going to either hear it one way as you're forcing me, or either one way or as you are coaching me to take these medications. Like, they don't want to hear you better take this, or I'm gonna have you committed if you don't take this, or I can do this to you. I mean, I would feel very myself like, what, like this person forcing me to take this? But Dr. Yedla, I appreciate you for coming as humbly, because that's how you have to, like, because the clients, they're gonna fight you regardless. I mean, in most cases, it's not going to be an easy feat. Like Unique said, it's going to be me attempting multiple angles, or me approaching the situation, your treatment situation or your treatment plan from multiple angles, and see which one best works for you. So I appreciate that too.
So Dr. Yedla, if you have a patient or their family or their significant other who adamantly disagrees with their diagnosis or the overall psychiatric treatment, how do you respond to that?
Yeah, this happens more often than we realize or want to acknowledge. But if a good way may be to start a conversation and ask them, okay, what happened? What is going on? Why do you disagree with your diagnosis? What is the diagnosis based on our assessment? And we try to get them to communicate with us. What exactly are they hearing, saying, and what exactly are they disagreeing with? Is it the diagnosis? Is the treatment? Or what is it? If we can get them to open up, then that gives us an opportunity as a team to say, no, look, this is why we think your son or your daughter or your spouse has schizophrenia. And without sounding like we're going down a checklist, but we can say, look, this is why we think that this. Let's think back to their last hospitalization. Let's think back to what led them to being in the hospital under a court order, no less. This is what it means. And we can try. And it's again going back to educating, informing, maybe giving written resources. If they want written information, we can do that too. And then tying it with the outcomes. What will happen if we continue with treatment, and what are the possible outcomes if we don't? So it really goes back to patiently and openly keeping the chain of communication and dialogue open. However, number of times it takes. And I tell this as much to my patients. I said, look, your time with me is your time with me. This is the time to ask me about your health.
Mm-hmm.
As many questions, as many number of times, and I will do my best to answer them. What I'm leaving unsaid is that I hope that at some point, maybe after discussion number 10, you will hope to follow one of the treatment plans. So that's where it is. I mean, what else can we do? That's it, right? I mean, we also have to remember, a good thing to remind ourselves is how would I want to be treated if I was on the other end, if I was in the patient's seat.
Mm-hmm.
When I go to my doctor's office and my doctor is telling me I have possibly a life-changing and a lifetime diagnosis, yeah, I need the time and I need the information to make those informed choices, because it's not like having a strep throat or a bladder infection or something that where we take antibiotics for a week or two and then we're done, we're all better. No. Most of the diagnoses that we deal with are long-term. So I think I cannot emphasize to myself and anybody who will listen, I work with students, whatever time and effort and patience we can spend on the front end with our patients and their families, and of course, as needed, it's like money in the bank. We need to keep that process of informed consent going forward all the time.
Mm-hmm.
Did I answer your question? I think.
Yes, ma'am. Yes, ma'am. You sure did. I mean, I definitely, in working with you, I definitely encourage the clients at times to, because they'll always remember everything after you meet with them. After the fact, I need to talk to the doctor again, and I'm like, that's not how this works. So what I started doing was, hey, write down questions that you think of, or I'll remind them, at least a week ahead of their appointment. Hey, you're seeing the doctor on this day, so go in and start writing down questions that you may have, and some of them will pull out a piece of paper, where they actually have questions written down in regards to, what's going on with this, what's going on with that. And I mean, for me, like when it comes to running into clients who just, it's a battle, in regards to treatment, in regards to their diagnosis and facing the fact that you have a diagnosis. I was, like my dad says, sometimes you got to provide people with a graphic illustration.
Mm-hmm.
So I'd be like, this is what happened when you were on zero medication and no treatment. You ended up in these places: jail, hospital, involuntary commitment. Now we're sitting in front of each other. Mm-hmm. This is where you've been when you have participated in those things. You haven't been in any of those places. You've been here with me outside of those places for 6 months to a year, sometimes a little longer than that. Clearly the secret sauce is working. And like when you explain it like that, some of the people you come in contact with, they're like, you're right. Or you ask them, hey, did you enjoy your time at the hospital? Mm-hmm. Did you enjoy your time at the involuntary commitment facility? By show of hands, who all enjoyed that? Nobody raised their hand. So if you don't enjoy being in here, guess what? You gotta
do the work.
You got to do the things necessary to not end up in places like that. And you start to see people when you explain it like that of, I didn't enjoy my time here. I didn't like being in here. I didn't like my family not being able to see my family, not being able to spend time with my kids, my dog, my chickens, whatever I got going on outside of here. When you explain it like that to people connect those dots. Mm-hmm. They connect those dots, and then they understand that this is not something I want to do, but this is something I have to do. And a lot of people, especially nowadays, we tend to put a priority on things that I want to do instead of the things that I have to do. And if you do the things that you have to do at the front end, like Dr. Yedla was saying, you can do the things that you want to do later. Mm-hmm. So like when you've been stable for a long period of time, that's where you can then have a conversation with Dr. Yedla and say, hey, I've been taking this medication consistently for the past 5 years or 3 years or however long you've been on it, if it's been an extended period of time. Is it possible that I can, get a decrease? Mm-hmm. And then, Dr. Yedla being Dr. Yedla will review whatever medications that you're on and see if that's an actual likelihood. Consolidating medications, because our goal as providers is not to overtreat you or over-medicate you. But that's what a lot of people's thoughts are, is that the goal is to shove you full of medications and have you walking around sounding like a maraca because you got so many pills bouncing around inside of you. But no, that's not what it is. It's not what it is at all. And I mean, in watching Dr. Yedla, work, I am always impressed with the way she's, always calm, no matter what's going on, no matter what people are saying, because some of our people say some of the most random things. And some things, like, she's so chill about it, some things go right over her head. And then I'm like, Dr. Yedla, this is what they're saying. They are? Yes. So, I mean, but at the same time, she does a great job of educating and explaining and answering people's questions. Because again, some people, they have all these questions, and she does a good job of explaining those questions. So what do you guys think about that?
I mean, I liked it. I think sometimes I've worked on the side of when clients are afraid to talk to the doctor about what they have going on. Well, they'll come and they say, well, the medication, it just is not working right. I was like, well, what does that mean? It's not working right. How do you think it's supposed to be working? Well, I don't feel anything. And so I said, well, have you talked to the doctor about that? Well, what did the doctor say you were supposed to be? How long are we monitoring to see the effects of the change? Well, I don't know. And I said, well, you have to talk to your doctor. It's good that you're confiding in me, but I didn't prescribe you this medication. You telling me is only a part of your solution. When you get there with the doctor, this is crucial information for you to share. I can process what's going on, why you may not want to share this, or what some of those concerns may be. But it's important for you to tell it to the doctor. So I was happy to hear when Dr. Yedler said she gives the clients time and time to talk to her about what's going on. And I think it's just important to remind clients, the doctor is your advocate. He or she is the person who's going to help you get to your best self. But if you're not being transparent, and we've talked about the nakedness that therapy requires and just mental health services require, if you're not willing to be naked and vulnerable, then you're not ultimately going to get the help that you need or deserve.
Right. And as you said, Unique, certain communities have that distrust in doctors and physicians just anyway, where it's hard for them to conceptualize or even process. I even in crisis, I noticed that a lot of times a client will come in and say, well, I've been on this medication and I stopped taking it, but I didn't tell the doctor about it. And now you're in a crisis. Mm-hmm. But you told me about it 2 weeks ago on a crisis call when you could have called your psychiatrist. Mm-hmm. Mm-hmm. So it's having this open-ended communication, as Dr. Yedler said, where I don't know how many % of psychiatrists are males and how overworked they are, but I hear a lot of times clients will say, hey, I can't get in to speak to my psychiatrist. They have a 6-week wait, or I'm in crisis even now working with 988. It's the same situation. It's the, overextension of a lot of the work that the psychiatrists are having to do because of mental health being such a need right now, and people being hospitalized and, constantly people are trying to be treated. So I mean, I can understand and, commend you on trying to even just have the open-ended conversation, because a lot of times it's either do this or it's no other options, or I'm not even going to give you an option. We don't have time to discuss an option or even answer your questions because we're so overwhelmed with clients. So I really commend you on that, like I said, because that's a disparity when it comes down to getting clients well and keeping them out of crisis. I've seen it so many times, and it's very disheartening to even have a conversation with the client about how to speak to your physician or how to speak to your psychiatrist, or why the psychiatrist waited so long and what do you do in between time, or how do we manage medication in between. So definitely that has been a huge eye-opener for me as well, just seeing how much of a psychiatrist is valued in our community, and in addition to being able to collaboratively work with them and the clients as well to make sure they're well, because it trickles over into the therapist role, because they're going to come tell you when they're not well, or they're going to call a crisis hotline and tell you that they're not well. And we're not equipped to handle those type of situations as far as medication management or medication reestablishment or medication establishment just in general.
So, if I may add real quick, one of you mentioned they probably stopped taking their medication and they didn't tell you, and then later on they tell you. It happens.
Mhm.
So if I have that opportunity, I say, okay, you stopped your medications a couple of months ago. Tell me what led you to doing it.
Mhm.
I don't know. It was too much. Whatever the answer they give. Why didn't you tell us sooner?
Mhm.
Your tone is very important,
Mhm.
and how we talk to them is important.
Mhm.
Well, doc, I didn't, then they'll tell you anything. I thought you'll be mad at me, or you'll be disappointed in me, or whatever. So now they're bringing the personal, the interpersonal thing,
Mhm.
and not so much on the symptoms itself. And I say, okay, so how, and then you try to tie both those together and say, okay, how have you been feeling? And then I don't know about everyone, but I can say, and I think it's rewarding every single time for me. I bring, the elephant that's in the room, we talk about it. I said, okay, you told me this, okay? Did you see me losing my mind? Did you see me yell or
Mm-hmm.
scream at you? Did I throw you out of the office or any version of it? No. I am
Mm-hmm.
your doctor. You're my patient. This is your time with me. Whatever
Mm-hmm.
it is, you need to speak without fear or worry. And let's work
Mm-hmm.
on it as a team. If you feel like these medications were too much or causing side effects, talk to me. We'll find some
Mm-hmm.
other plan, because not being on medications is only setting you back.
Mm-hmm.
It's taking you back to where you were 6 months ago. And it's
Mm-hmm.
not a fun place to be. So we have to spend, like I said, we have to give them that time.
Mhm.
And also sometimes, I don't try to make the session about me, because it's not. But what we can tell the patients is this: what makes you think that you might be the only one taking medications?
Mm-hmm.
I
Yep.
could be in my doctor's office. I could be taking 3, 4 different medications for different things. You
Mm-hmm.
just don't know
Mm-hmm.
about it because it's not about me. So you have to emphasize that we are all human and we have stuff going on. And for me to be a good, functioning, clear minded psychiatrist, I need to take care of my health.
Mhm.
So sometimes I bring in the personal too, and I think it's appreciated. And whatever that barrier to care was, or whatever that was there, hopefully we've been able to work past that now until the next one sets in.
Well, Dr. Yedla, I'm so glad you brought that up about addressing the elephant that's in the room because, working as a case manager, I got to do the inpatient, and a lot of the clients that came in to like Wellstar, right? When I worked inpatient, some of them they did take the medicine for a while, and speaking from the male perspective, I can touch on this. There was a lot of them that suffered from erectile dysfunction.
Mhm.
Then we also have on the other side of some of the other side effects is that we have people who use illicit drugs.
Mhm.
Yeah.
And I would run into that, and so the person was, hey, like, either I want to, take this drug because I'm self-medicating at this time, and I want to be able to feel the effects of the street drug. So I know I can't take what Dr. Yedla gave me because that's going to counteract. So then they're not taking it because they want to get high. That's how they're going to deal with their pain. And then the other person's not taking it because they're having erectile dysfunction and they want to be able to have sexual or intimate relations with somebody, right? So I'm dealing with this, and some of them are so ashamed. Um,
Mhm.
and that becomes the elephant in the room. It's like, well, why did you stop taking it? And the person doesn't want to tell you, well, hey, man, I'm having issues. I have a girlfriend I live with here, man. I can't take this. But then you're threatening your girlfriend with a knife. So which one is it? Like, you guys have to come to an agreement. Like, I think it's a little better for you to take this medication and maybe have to take something else, Viagra, whatever you need to do. But it's much safer than you chasing her around with a knife. So those are some of the things I think people don't want to talk about because it is a little embarrassing. And I'm pretty sure you get to hear a lot of those conversations, Dr. Yellow.
Oh, yes. We hear them, and sometimes when we work with the team, maybe they'll find it easier to share it with RJ, and then RJ will let us know, and then we'll try to find a find a solution. But it is a struggle because it's not just the medications, but a lot of other things: being overweight, having diabetes, high blood pressure, taking those medications. It's very interesting. A whole lot of things can kill sexual desire or functioning. But it's amazing how our patients latch on to it is this
That
medication,
one thing.
it's this thing that it may be, it may not be, but it's an ongoing issue. We try to educate, inform, make adjustments, dose reductions, changing things, you know, and this one, and then the other thing is weight gain is very commonly an issue. So, what I really want to say, but I refrain from saying, just to kind of send a message, and I won't say it that way, but necessarily, but I always think, do you want a killer body or a killer brain? It may sound unkind, like I don't care or not, but depending on what we're dealing with, it may be hard to say you can have both, but it's not going to be easy because our medications cause side effects, weight gain, hair loss, whatever, or sexual impact. It's hard. So we have to acknowledge that it's hard, but still not give up and try to work with them and try to find a middle ground.
Right.
And the brain is the control center. So, I would prefer my brain to be functioning so everything else will function in alignment than me missing one little impairment over there.
Exactly.
Where something may not get dry, something may be dry versus not rising up, or, my mind not 100%.
Yeah, because if your mind's not working, the rest of you is not going to work.
No,
right
it's
either.
not. It's not. It's
You're not even going to be able to focus on that. And
Oh.
what the thing that I always try to explain to people is that there is going to be 0 medications that you're going to find that have 0 side effects.
Exactly.
So, like Dr. Yedla was saying, it becomes a cost benefit analysis. Either, you have a killer body or a killer mind, which one? Some instances you're able to have both, but in other instances, not so much. So if taking my medication is going to keep me out of places like the jail or the hospital, an involuntary psychiatric facility, or being in a bad spot, emotionally, mentally, spiritually, I'm willing to negotiate some of the side effects, some of the issues that may come along with taking medication. Now, some of those side effects, not so much. I may have to go, sit down with the primary care doctor. Hey, I might need you to, write me a prescription for one of them blue pills, something,
Right.
But again, like a lot of times, like with Dr. Yedla being a woman, a lot of the males don't feel comfortable having that conversation with her.
Right.
So now we have one client, he's very honest about that. He don't care who it is, he's telling it, but a lot of them don't feel comfortable talking to a woman about that. So they'll tell me to tell Dr. Yedla, and I'm like, I'm right here. We're all right here.
Yeah.
We're meeting with Dr. Yedla together. You're telling me to tell her, she right there. But a lot of them, they just feel
It's
comfortable
uncomfortable.
telling a
Yes.
woman, hey, I'm having reproduction problems. Some of them feel some of them feel, just, uncomfortable with that. And heck, I even have female clients where they feel uncomfortable talking to you about that. So they would prefer to talk to the nurse or talk to Dr. Yedla about that. Hey, can I talk to Dr. Yedla by myself? Sure. We step away, let the client talk to Dr. Yedla by themselves to be able to have that one-on-one, that one-on-one moment to be able to express themselves because they don't feel comfortable expressing themselves in front of everybody. So we do give them that opportunity. But it's very imperative that clients get that opportunity to be able to express I'm having side effects and having issues. Because again, I won't know that you're experiencing them if you don't tell me. Now, some side effects, I can look at you and tell that you're experiencing them because I watch people.
Right.
So if I start to see you develop a tremor, or I start to see that you can't bend your legs, or like I had one client, he started clicking his teeth out of nowhere, or doing something else. Those are physical side effects or physical issues that you're having because of the medications. But there are other things that you may be experiencing that I won't know until you tell me, because I'm not with you and I'm not a person that's around you all the time. So I need you to be able to share that with me and be able to feel comfortable, as Unique has said on numerous occasions, having that safe space to where you feel like you can come to me as somebody that's working with you to say, hey, like me and my girlfriend or me and my significant other was about to be intimate and it just didn't work. Nothing we tried was making it work. I don't know what's going on, but I think it's the medication. It was working before. I'm on this medication. Now, all of a sudden, now it's not. Now, some people, it's not the medication. They're just, and that's just being honest with you. Some people are looking for an opportunity to not take any medicine. Yeah. I've had that happen as well, because they'll, like Dr. Yedla will tell you, they will literally just be able to pinpoint this medication right here out of the 30 that I'm taking is the reason why stuff is going bad. And it's just like, how do you know? The internet.
They know.
Well, no, I mean, a lot of people,
they Google. They Google and they ask somebody else.
Their cousin who did it.
Yeah.
Their cousin had it and it did them the same way.
Or their pastor has told them, not to take the medication. And so, like, I had one client where his mom took it upon herself to not give him his nighttime medication. His antipsychotic was in his nighttime medication.
Oh.
And so, I asked her, so she would call every day, complain about his symptomology, what he's doing, how he's acting. He's talking to himself. And so myself, case manager, go out to the house. So we go and meet with the mom and him. And so she's explaining to us what she did. And so I was like, can you go get the medication for me? She gets me the medication. So I'm looking at it. So you're not giving him the night medication. The only difference between the daytime medication and night medication is there's no antipsychotic. So that's why he's experiencing the symptomology that he's experiencing, because you made a decision to not give him his antipsychotic. Well, I talked to my pastor and I talked to people at the church, and in that moment, I was on 10. I didn't even rev up to 10. I was on 10 because, like I explained to her, I applaud you for going to church and seeking spiritual guidance from whoever you choose to worship with. But I asked her, did any of those people go to medical school?
Right.
Does any of those people have to live with you? That's the question.
Yeah.
And so then I asked her that too. So when I asked her those questions, she said no and no. None of the pastor didn't go to medical school. None of the people she goes to church with went to medical school, and none of those people have to live with him. Mm-hmm. So again, you have a nurse and a doctor who come out here who are trained medical professionals who come out here and provide service to your son. They're telling you that he needs this medication because ... We've seen what happens now when he doesn't have that medication. Mm-hmm. So prior to you just making the command decision to cease that medication, you should have spoken to the doctor or the nurse to make sure that we could have done this in a safe and controlled manner versus you just freestyling it and now he's unwell.
Mm-hmm. But I think it goes back to education, right? Educating people on the importance of the treatment plan altogether. We're not just arbitrarily looking on, the doctor doesn't look on a drug chart and say, oh, boom, that one, that's the one I'm gonna give them. This looks like a great one to prescribe to everybody today. Yep. No, they look at all of the different factors, the age, different demographics, other health challenges that the person may have going on, and they formulate a plan that's going to be best for them. And so when anybody starts tinkering with that plan, you never know what's working, what's not working, what needs to be adjusted. If it is a biological issue that might be at play, why a person's symptomology is the way that it is. And so when the average person just decides, I'm just going to do something different, then it's like I tell my child, you get the results you get when you do what you want. Mm-hmm. You can only get what you're going to get. Now, you could do what I'm telling you, a person who has more experience and more knowledge, and then you can get the result that you are intended to have, or you can have it your way. The choice is yours, but you can't be mad at the result.
Mm-mm.
Right.
Exactly.
The result will be with the effort that you put into it. And so for this client and his mom, I think for her, it's just like, while you might be comfortable or you may think you know what's best, what's the quality of life that her son is going to have? Right. How would he feel about this? Does he like this symptomology? Yeah, it might be an annoyance to you, but think about how he feels.
Mm-hmm.
right? He's going around people and he doesn't feel like maybe himself, or he's hearing voices that he didn't hear when he was taking the medication, but you're comfortable. And so you got to kind of put yourself in that person's shoes. What do they need? What is best for them? And I don't think caregivers always understand that.
Mm-hmm.
And that's what makes what we do the
Challenging.
layer harder and challenging, because I know it's a lot, but you signed up to be a caregiver.
Right.
And in being the caregiver, it's about us all working together as a team to get what's best for the client, not what's most convenient or most socially acceptable for you.
Right. And I always say this, better outcomes come with better education. I can't even say that enough. As crisis, you always see them at their worst. And it's typically not on their own decision making, it's on someone else. Depriving them of their appropriate treatment or medication, or them going through certain life stressors and things like that. So I really have to say that we have to really have these important conversations with the caregivers, even the children. Like, I've had one client tell me that she stopped taking the medication for her kids just because she wasn't able to drive them to school. So there's so many layers to each person, and environmentally, emotionally, spiritually, as we always say, that hinders them from even possibly making good decisions. And like, when it comes down to it, is I believe that your family dynamic has a huge impact on your treatment. It doesn't have, and most of the time, like, they don't even speak for themselves in my treatment teams or these important meetings. They have someone else speaking for them. So I believe, like, now it's important for us to really look at what they want as individuals, not what the other people want, for us, like that, like Unique said, the comfortable aspect of it. Hey, I can get rest at night because the person isn't pacing the room 400 times, or he's not manic tonight, or, he's not outside screaming at the neighbors across the balcony because he hasn't had, as RJ said, his evening time medication. So, like, better outcomes come with better education, and is coming from directly educating the individual and even just the family, because the family controls everything pretty much, because a lot of them are to the point where they do have disabilities and developmental delays too in some areas. So we do have to factor those situations in too.
So, Dr. Yedla, when you are meeting with a client, how do you decide which medications to prescribe to them? Like, how do you figure that out?
Well, of course, by then we have a diagnosis we're working with, and there, within each class of medications, there's different ones, and each one, as a class, they share common benefits and common side effects. And within each class, they may have unique benefits and side effects. Some may be more concerning than others. So I usually start off by going over the diagnosis and saying, okay, these are what we have, and saying, okay, this diagnosis and the degree of symptoms you're having is best going to be managed by medications. And these are the options we have. This is another area we have to spend, at least in my role as a psychiatrist, I feel like we have to spend a good bit of time. Again, it's like spending time on the front end, starting the process of educating and informing. And my experience, and it makes sense also, it hasn't been as much on, they don't ask as much questions on the benefits of it, because they assume it'll help, whatever the mood swings or this. But the majority of the time we spend on discussing side effects. And it may be something that is not worrisome, like impacting your appetite or sleep or this or that, versus much more like, can it do something to some blood counts? Can it cause a lot of weight gain? Can it put you at risk for diabetes? Can it do something else? Can it have an impact on your pregnancy if you were to get pregnant, and those kind of things? So So what I do, instead of trying to overwhelm them with a lot about everything, in my mind, based on my training and experience, I start saying these might be the first one or two or three that might help you to get started. And we discuss those. If none of those seem appealing or things like that, then we go down to others. So we keep going. And but one more thing we have to keep in mind is, I mentioned earlier too, these are not going to be something they take for a week or two and then stop. So another very practical system issue that comes to play is affordability or accessing them. One is will these medications do what they'll do or supposed to do, and then how can we get them to be able to access it? So then we talk about, we look into their insurance, no insurance to Medicaid to some commercial insurance, and it's a process, and we present those options, and we go from there.
Thank you for mentioning access to affordable medications. As a social worker, that's what I stick on all the time, because I've seen people not be able to actually afford their medications because they're making a decision. RJ knows we've talked about this off camera. They have to make a decision on where their money is going to go. I think people forget that if someone is on Social Security and they're only living off of $800 a month, we have to really be realistic of where their money's going to go throughout that 30 days. It's very hard to stretch that. You can try. I might be able to stretch my paycheck a little bit, but I don't think $800, because I've made $800 here and there in my younger days, and usually that was after 2 weeks of work. You know what I mean?
Right.
So I can only imagine 1 month of trying to stretch $800. And I think a lot of physicians, especially some doctors, aren't realistic because they don't understand how everybody has a different financial situation. How is this person going to be able to make it to the drugstore and back if they don't drive? How is this person going to be able to afford this monthly payment of, even if it's only $20 or $30 a month? Sometimes we have to always take that into account. It gets difficult. It gets very
So I
difficult.
call. Oh, I'm sorry.
Yes.
Yeah,
No.
many times I'll even call a pharmacy, either the pharmacy next door or somewhere. We try to get a pricing about cash price. Okay, this is the medication, this is the dose for 30 pills. What is the cash price? And just to get an idea. And so that way, we're trying to remove one issue at a time. So we don't send a prescription, they go all the way there, and then they say, no, I can't afford it. And we try. It's a work in progress. We do try to access any programs we have from the drug companies or other things, samples. But when I'm asked, sometimes people will ask me, what is the best medication for bipolar or for this? I said, and I'm not trying to be snarky or silly, but I say, hey, the best medication is the one that they can afford the most and that they can tolerate. Really, it comes to that. Because what's best for someone that has commercial insurance, if my patient with no insurance or Medicaid cannot afford it, it's useless for them. It's of zero value to them. So, but we do have choices. More and more medications are becoming generic, and the ones that are branded also. I mean, we do have options. So again, this is another area we have to keep going. And it's not like set in stone, because today they had this insurance. Come September, October, they might have lost that, or something changed. Or they're in the donut hole or this or that. And, then what was affordable suddenly became not so. But again, this is where we work in a community mental health center, and think what you mentioned, Khalil, a lot of that maybe in a hospital setting or in a private practice setting, maybe it's maybe fast moving. They don't pause to think, okay, how is this person going to get this injection that's going to cost them $1,000 a month?
Yes.
So we try to use samples, we try to do whatever and get them on patient assistance or whatever. So, but again, the trick is to try and not have our patients fall through the cracks in between this time period while we are getting them this help they need.
Almost definitely. And I think that's a huge part of crisis as well, keeping the continuum going where the clients aren't falling through the cracks. And as Dr. Yetla said, the affordability of medication, because that's the hugest concern when a client's not able to be medicated is, hey, I couldn't afford the medication, or they gave me all these prescriptions. I can only afford one or two. I'm on a set income. And you hear these things and you have to provide these additional resources. But outside the point is getting them the correct treatment and recommendations before they leave so they won't have these issues on a continuum.
Another thing I try to do, and I don't know if they feel this way or not, is I feel bad, but I don't want my patients to leave or think that just because I'm going with a generic or a $4 per prescription or something, that it's not a good medication. They all, you don't want, and it's not true also. They're all good. They all came into the market, following the same procedure. They were all branded. So, and I in fact argue that we have a lot more data about the ones that are now generic. They've been out that much longer. So I want my patients to be fully willing to participate in their care. And part of that willingness is this building trust and saying, I'm trying not to give you anything that's inferior or lacking in data or things like that. So we have, so I do emphasize, hey, we know a lot about this and,
and
I
it's
mean,
a partnership.
it is.
Getting them to understand, I want you to be successful, right? I don't want to suggest or provide services that are not going to be beneficial long term. I think Dr. Yedler, you said earlier, we're not suggesting something that's going to be 1 or 2 weeks. We're suggesting a plan of care that could last your lifetime. And so when you think about lifetime treatment, that gets really expensive, even if you have the best insurance and the longest or the most amount of money. It's going to take lots of time, lots of effort. And so I want you to understand as a client that I want you to communicate all of the factors that factor into this care and be mindful. I'm doing the same for you as well. I'm not just giving anything arbitrarily. I'm trying to give you what I think is best for all of your circumstances. I think that's awesome.
Yeah, it's been kind of like my experience. Like for a lot of people, they get caught up on the price, especially generic versus name brand. And I have to explain to people, like when you go to Walmart and you buy groceries, if you only got $20 in your pocket, are you gonna get the great value bag of garbage bags, or you gonna get the name brand bag of garbage bags? You're gonna get what you can afford. So it's the same thing with your medications. It's not about because it's it's not the name brand version of the medication that it's not going to treat you as effectively as effectively as the name brand version. I immediately, because of the nature of a lot of the clients that we come in contact with, I automatically, what is the generic form? Is there a generic form? What's the cheapest option? Right. Because again, by working from there, like for me, when I worked at a auto parts store when I was in undergrad, when you come in for brakes, you tell me the make and model of your car, the year and everything, it pulls up all the brakes that are available for that car, low, middle, and high as far, and I let you decide, hey, if you get these high ones, it's going to be nice that you got these brakes, but again, they super expensive.
And they're going to burn out at the same rate.
They're going to burn at the same rate.
We need to tell our patients that your doctors and therapists and social workers or whoever you talk to, whoever doing this, are more than likely taking these generics too. Believe me.
Right.
Man,
When
what?
I go get my medication, I want the affordable one.
I'm trying to save all my coins.
Yeah.
Right. I did have a question for you, Dr. Yedler, because I work in the substance abuse field, and I talk to clients all the time. And some of them do not really believe me, even though they've experienced drug-induced psychosis. But they don't really believe me the amount of damage they're doing to their brain. And actually, they don't really believe me that eventually some of the symptoms that you see from severe mental illness will be mimicked. And sometimes you will be able to actually damage your brain so much so that it will be inoperable to go actually perform the way it used to perform. You're actually going to be, I don't want to use the word retarded, but you will be, obviously, there'll be some brain damage.
Some impairment
from that. Yes, the impairment is the word I wanted to use. And so trying to convey this to people, they don't really believe me. But since I have a psychiatrist, I think it'd be very instrumental for us to kind of talk about that real quick, just so people who are listening to me or listening to this right now will see that there is impairment that will be long lasting from especially street drugs like heroin, cocaine, meth, fentanyl, can really do some serious damage to the brain.
So this is an area where I think as a society, as a city, as a state, as a nation, we are not doing very well at all. A big general statement of about substance-related issues. We all know that. So one thing I say is this, so I try to emphasize, and I'll try to keep it short. See, our brain, or our mind or our brain, where all psychiatric illnesses stored, is a part of our body, right? So if you think of the heart, if somebody has had heart attack after heart attack or after heart attack, multiple heart issues, sooner or later they're going to have something called heart failure. Same thing, if somebody has stroke, mini stroke, big strokes, sooner or later we're going to see an impact in their functioning. Maybe it was not the first mini stroke, maybe it was not even the second one, but eventually we don't see them bouncing back to what I call to their baseline. What was their baseline 2 years ago may not be their baseline today. And we are seeing this, and especially once I've started working more and more with the patients that we see on the ACT and Bridge teams, the ones that are in and out of the hospital a lot, we are seeing this in real time. Their brains are not getting the time to heal, for lack of a better way of saying it, to heal and be rehabbed and recuperate, meaning taking medications longer or consistently. So that's one thing. But the second thing, to answer your direct question, is there is yet, for me to see, I have yet to see a brain that actually benefited from doing heroin or cocaine or meth or even marijuana for that. Now I think that's on its own, the way, depending on who you're talking to, but you get what I'm trying to say. Not one good thing happens to that. And I'm very open. I would also admit openly here, this is one area of not my strength, substance-related things, partly because of a multitude of reasons, but we have to deal with it. And there is not one tool in my armamentarium that we can prescribe, that we can suggest, that has the power to do better for our patients than cocaine does or meth does. Meaning, something about those drugs is always going to draw our patients every single time. And it's very unfortunate and tragic even. And pharmacologically speaking, we don't have enough pharmacological interventions to help them safely detox and stay sober. We don't. We have a few, but it's not nearly enough. But if you look at actually sober living places and rehab places, even that is very pitiful,
Yes.
Either they're what we have are always full or they're expensive. So the message we try to give, again, it's a challenge, is, if every time they choose or not able to stop themselves from using drugs of abuse, they're risking their mental health, they're risking their freedom and risking going to jail, and basically completely risking destabilizing their whole life.
Thank you so much for touching on that. And that does answer the question right there, because I think, and RJ, I'm sorry that I segued, but I really think the people who are listening to this, especially for the African American community, I love to get that out there. They need to understand that they're not doing themselves a benefit by using
A
any
disservice.
substances. You're doing yourself a disservice if you're having any type of mental illness, and then you're impairing yourself more by putting these drugs on top of it. And I wanted to get that out to my community. I want people to see that this is a lie that you've been, falling into. Even, even the marijuana abuse. If you have a mental illness, add marijuana to it, you can be more than paranoid. Like, they don't get this sometimes. So I just wanted somebody to hear it from a doctor, so they.
So I have one last question, Dr. Yedla. So it's a two-part question. Why should someone care about their mental health? And why is it important that we spread awareness about mental health?
So I'll turn it around and I'll ask you, RJ. I will ask, why should someone not care about their mental health? So is it less important than something else? I can make it personal. I care about my mental health because I care about having a good quality to my life. I don't want to just merely exist or go through motions of my life every day. If I was in that position, it would be almost unbearable for me to have that kind of a thing. But also for me, whatever, every day I have different roles in my life every day, like we all do. I'm a daughter, I'm a wife, I'm a whatever. And I want to be able to, as much as possible, be able to function well. And, because my functioning well is tied in with these other things too. So I want to be well for myself, but I also want to be well for those around me. So I think, and also mental health, we like to, even patients, amazingly, they will make a distinction and say, oh yeah, I'm talking about my real doctor,
That's so rude.
Ooh, wait.
That's a whole other episode.
Yeah, it will never fail to bring a smile to my face, but it's always in good humor. And I'm not upset or offended, but I look at it more like they have compartmentalized their physical health and their mental health. And they're coming at it, I think, from that perspective. And they say, oh, you don't need to worry about my sugar stock. I got my other doc, my real doc, or whoever taking care of it. But I would argue that, again, I mentioned it earlier, I think my brain is a part of my body too. If I am not well mentally, how can I check my sugars? How can I try to eat healthy? How can I make myself exercise? How can I go to work? How can I do what I've trained for so long? There are many things. So I think I think it is most important. We can go back and forth. If I don't have a intact or a good functioning brain, then what good is it, to walk 5 miles a day? But if I didn't walk 5 miles a day, I might be putting my brain at risk for strokes and all. So I think we need to look at it as a whole. This is our body. It's on a continuum, and we need to look at it that way. And sometimes it's okay. We compartmentalize, and that's okay. But in a bigger way, I think we need to. One impacts the other. Let me put it that way.
100%.
What was the other part, RJ? I lost.
Why should people spread awareness regarding mental health?
Yeah. Okay. So the good old stigma and all. If you think in America we have stigma now, you never went to a place like India. Where I grew up and spent my medical training, I mean, I didn't know that there was something, very minimal. There's a lot of stigma, but we've come a long way. So that's one thing. I think educating, informing is key. I think that's one way. So also we also need to say you didn't do this to yourself. You didn't cause your schizophrenia. You didn't, and with that we tie it in with building insight so that we can get the help that we need and not be ashamed, not feel guilty, not be embarrassed, and maybe be able to advocate for ourselves or somebody those around us. So it really takes a village. And then maybe even now I'm getting very aspirational, maybe we can make or fight for systemic changes too, because we haven't delved into that. But nothing is graying me faster or wrinkling me faster than system issues. I got the meds part of it, but the system issues or so there is a whole thing. So I think we all, in whatever roles we play, doesn't matter, doctor, therapist, social worker, it doesn't matter. We are in the field. I think we need to educate, inform, and get them to the point of taking charge of their own health. Everyone, I would go as far as this. I only semi-joke about it, but I'm in the process of setting up a behavioral health advanced directive for myself. And that would be that, if my family, anybody saw me, for lack of better way of saying it, but to cause to make a point that I'm losing my mind, that I'm getting psychiatrically sick, this is what I want them to do. Find me a good psychiatrist and make sure those meds get in me one way or another, because the odds are high that I'm going to think there's nothing wrong with me. And I won't want to take the meds. We've talked about that, right? So it could happen to any of us. So I think information, education, awareness, removing stigma, I think that's on us. And also, finally, I'll say this: what the mind does not know, the eyes do not see. So if you don't know this is a problem, then there is no problem, right?
Yeah,
That's
absolutely.
what I'm thinking if I'm not doing well. So I think it's information, education, that is key. Removing ignorance, we need to shatter all those barriers, and because then I don't think where we are in that as a society, but I don't think we're anywhere close to. I think we're better than where we were 10, 20 years ago, but we still have a long way to go.
For sure.
Definitely, I am definitely in agreement with that. Our goal with this block of episodes is to increase the awareness in regards to, getting people to understand the importance of taking stock of what's going on with you, and then the options that are available to you once you figure out and once you're recognizing that something is going on with you. So if you like what you heard, we ask that you subscribe to the YouTube, turn your notifications on. We're also available to listen to on Spotify, Anchor, and Apple Podcasts. And so this is Try Not to Overthink It. I'm RJ.
I'm Jasmine.
Camille.
And I'm Unique.
And we will catch you in the next episode. We're signing out. Later. Peace.
Deuces.